Hi everyone, today I'm going to share how I will approach caring for children and adolescents in a psychiatric settings once I'm practicing as a provider. So when I start assessing a child, I will never start with what's wrong. Instead, I will focus on making the visit feel safe and comfortable. I will start by talking about things like friends, sleep, and what a typical day looks like. When that child feels relaxed, I will gently move into more specific topics such as mood, anxiety, trauma, eating habits, or any topics about self harm. I will also make sure to speak with caregivers separately, but I will always give the adolescent private time as well because many important details don't come out in front of parents. For screening tools, I will be matching the tool to the child's age and presenting concern. Let's say for ADHD in a school age children, the Vanderbilt is reliable. For depression in teen, I will use the PHQA. For anxiety, I will prefer the scare. And for autism screening in toddlers, the EM chat is a standard. For trauma, I will use the UCLA PTSD reaction index, which has a strong evidence support. These tools will help structure my assessment, but I will never rely on them alone. They just complement my clinical judgment. And when it comes to medication, I will be cautious but confident using it when evidence supports the decision. Many medications are used off label in children, but the AACAP emphasizes off label does not mean inappropriate. It can be ethically acceptable when there is supporting research or when benefits outweigh risk and when untreated symptoms will cause more harm. Typically, I will start with therapy for mild to moderate symptoms. If the impairment is moderate to severe or if evidence shows better outcome with a combined approach such as in the TADS study, for adolescent depression, I will consider medication with full informed consent and, of course, close follow up. I also believe culture and ethics are just as important as the diagnosis, and I will respect each family belief, traditions, and possible stigma around mental health. I will adjust my language to make them feel understood rather than judged. Ethically, if a child is suicidal or medically unstable, safety will always come first, even if that means temporarily limiting autonomy to protect life. So overall, my approach will be uh, just build trust first, use structured tools wisely, involve families while empowering the child, and treat throughout a balance of therapy, evidence-based medication, cultural sensitivity, and ethical care. Thank you everyone for listening, and I hope everyone has a great term.